I thought I have to pull Brian in on this one. He does have a wonderful head of hair, but just like every guy out there, the older you get, you start thinking about it, right? You start worrying about it.
I'm worried about it.
In fact, hair transplant surgery, get this, grew in popularity by 76% from the year 2006 to the year 2014. Dr. Scott Thompson back on the show from Utah Facial Plastics. Is that true? Do you see that in your office?
Yeah, I do, and I think the big reason for that is that old school hair transplant was plugs. It was very obvious. It was very unnatural looking, and there's been some huge advances in how hair transplant is done, and it works. It looks completely natural, and it's pretty amazing, actually.
So what are you doing instead?
So in the past, multiple grafts of hair were just put in almost as a plug, and now we get under a microscope and we split each hair follicle into a single unit, and that's transplanted just like a normal hair is. And we put certain hairs at the front, certain hairs at the back, and we just know how the hairline is. We know what the natural hairline is. We know how the hairline recedes, and so we're able to use all that information to make a natural
So you're
result.
not taking a section of hair anymore, and it's from the back,
We are.
right?
We still take a section in certain cases. We'll take a section and then slice that up into individual hair follicles. Or the other method for someone that wears real short hair in the back is to take the hair follicles out individually in the back, and then there's no scar on the back, no linear scar. And so there's two ways to do it, and we use both of them.
You really changed the game here.
It is a game changer. It really is. And so we have a lot of younger patients that come in and say, wow, I really like this idea of the FUE method, which is follicular unit extraction. We take out an individual hair because there's no scar on the back of my head.
Dr. Thompson, we're looking at before and afters while you're talking, and some have a lot of hair loss before, and some have just a little bit. How do you know it's the right time for you? How do you know if it'll work for you?
Well, the main thing is to have a consultation, because everyone has a different rate of hair loss. Depending on your age, depending on how much hair you have right now, that will determine what recommendations we would make. And so it's hard to make a generalized statement without having a consultation.
Is there a good age that you recommend people come in for? Because as a guy who's still in my 30s, it's something that worries me, but I don't know if I'm going to end up like my mother's father or whoever in my family history.
Is that true, by the way? You look at mom's dad.
That's one factor, but there are so many things that come into play. And, if you're in your 40s and you have this head of hair, then you're probably not going to lose it all. But if you're in your 30s and you're starting to notice some changes, it could accelerate very rapidly, or it could remain stable. And I would say any time is a good time to come in for a consultation. And sometimes I'll turn people away and I'll say, you know what, you just need to take medication for 5 or 7 years and we can see what happens, and then we'll determine if a hair transplant's right. Because if we go in and do all this hair and then you lose everything else, that could be a big problem down the road.
Where is hair loss most common on men? Is it back here or is it right in the front?
Male pattern hair loss is usually here in the crown and then just receding in the hairline in the temporal area.
So now I've got it right here. So my family history has got these two little spots. I don't have the top, I don't have any of that other stuff, but I have this little,
and that's one of the
widow's
common
peak,
things.
Or whatever you call that right here?
We just call it temporal recession, but yeah.
Is scarring, does it happen in either of these methods, or you won't see where you take the hair from the back of your head?
With the method where we remove the strip, you will have a linear scar. So if you wear your hair longer, it's not visible, and it tends to heal really well. If you wear your hair short, then, like I said, we just have the little tiny pinpoint scars.
Once you have it done, will you have to have it done again, or will this last?
That all depends on how much donor material you have back here, how much we have to use, and then what our final goal is, how much you have to start with. A lot of times we are recommending a second session because people want it to be as thick as possible, obviously.
You know what you could do is you could just have like business in the front, party in the back, and no one would know the difference, right?
That's right.
The before and afters, are you seeing incredible results? They're just so much fuller, that fullness in the hair.
We are, but you have to take into consideration that it really takes a full year for the results to be apparent. It takes a long time for the new hair to grow in, and so it's a process. But yeah, I've been very excited about it. It's something that I've done throughout my whole career, and I'm excited about it.
Well, there's no one better. There's no one better to talk to about this, and he can give you all of your options. Dr. Thompson is at Utah Facial Plastics. Right now, they have a special going on. You get $750 off NeoGraft or 25% off PRP injections. So go to their website or give them a call for more information. Goodforutah.com/GTU, and we will link you. Good to see you. It's confidence, right?
It is.
This is personal.
Yeah, what we see is the initial impression is really important. So.
And that's comforting as a guy to know that I can have options to make sure that this stays where it needs to be.
Looking good.
And coming up next, everybody, how to tell if you're in a